Dear colleagues, my name is Nath Arwa, and in this brief video I would like to share a few tips that may help you dispense pharmaceutical agents to patients seeking to quit smoking in an effective manner. Now, I would like to begin by asking you a rhetoric question. When was the last time you ensured that these expensive remedies we dispense to help our esteemed clients achieve their goal, the tall order of quitting smoking through effective counseling? When was the last time you clarified to a nurse taking care of an inpatient on these very expensive agents how to effectively administer them, and by extension schedule the dose correctly? Lend me your ears for a short while as I walk you through effective medication use counseling for patients on nicotine patches, on Zyban, and nicotine gums. Now, the nicotine patches come in three strengths of 7 milligrams, 14 milligrams, and 21 milligrams. And the choice of the patch to be administered dermally is dictated by the total number of cigarettes a client smokes on a daily basis. Now, in the market, as I said, we have three strengths of 7, 14, and 21. If your client smokes more than 10 cigarettes daily, he or she should administer one 21 milligram patch dermally on a daily basis from week 1 all the way through week 6. Now that should be followed by a tapering to one patch of 14 milligrams from week 7 through week 8. Now lastly, during weeks 9 and 10, the 7 milligram patches should be administered dermally once daily. Now, for clients smoking less than 10 cigarettes a day, therapy should begin at administration of one 14 milligram patch dermally daily for week 1 through week 6. Now that should be followed by a tapering, i.e. one 7 milligram patch from week 7 through week 8. Now, as a pharmaceutical practitioner, remember to clarify or to clearly counsel the clients on the best mode of patch administration, i.e. they should apply a new or a fresh patch dermally every 24 hours. And this should be done on a different skin site that is clean, that is dry, and that is hairless for obvious reasons. Now, they should wear the patch for a total duration of 16 to 24 hours. Now, in case clients experience craving for nicotine in the morning hours, the day after administration of a patch, remember to advise them to wear the patches for the entire 24 hours. Now, in case clients experience vivid dreams or insomnia, remember to advise them to remove the patch at bedtime and wear it for a total duration of 16 hours in a day. Now, don't forget to remind the clients not to cut the patch, as this would make the release of nicotine a bit erratic and compromise the pharmacokinetics. Next, I would like to talk about the nicotine gum, which is locally available in Kenya in two strengths of 2 and 4 milligrams respectively. Now, for those clients who smoke more than 24 cigarettes daily, it's recommended we initiate therapy using the 4 milligram gum. These clients should chew 1 4 milligram gum every 1 to 2 hours for a whole week, for the first week, all the way to week 6, after which tapering should be done, whereby they'll chew 1 4 milligram gum every 2 to 4 hours for another 2 weeks, from week 7 through to week 9. And lastly, from week 10 through to week 12, these clients, or this category of clients, should chew 1 4 milligram gum every 4 to 8 hours. Of course, by this time we expect them to have overcome the urge to smoke and to have quit smoking. Now, for clients who smoke less than 25 cigarettes daily, or who smoke up to 25 cigarettes daily, not exceeding the 25 mark, the therapy is as follows. From week 1 through to week 6, we should advise them to chew 1 2 milligram gum every 1 to 2 hours. Now, from week 7 through to week 9, they should chew 1 2 milligram gum every 2 to 4 hours. And from week 10 through to week 12, we should advise them to chew 1 2 milligram gum every 4 to 8 hours. Now, for optimal clinical outcomes, remember to sensitize your clients to do the following. Number 1, they should avoid eating or drinking any fluids 15 minutes prior to or during the time they are using or chewing the gum. Now, they should also chew the gum continuously until a tingling sensation or a peppery flavor appears on the tongue, and then tuck the gum between the cheeks and the gum, or in between the buccal mucosa and the teeth, just for optimal absorption of the nicotine into the bloodstream. Now, remind clients to rotate the gum. It should not be on only one side of the jaw. They should keep rotating it from one side to the other. Now, between the rotations, encourage them to chew the gum. Now, this is to maximize buccal absorption of the nicotine. Now, if the gum is used alongside the nicotine patch, tone down the dose in such a manner that patients don't undergo nicotine toxicity. Now, we also need to sensitize clients that the gum should not be chewed endlessly. The gum lasts approximately half an hour, 30 minutes to be precise. To avoid using gum we should avoid using this nicotine gum in clients with dentures, with dental caps, or partial bridges. Now, the gum may stick on this dental wax unnecessarily. The gum should be used cautiously in clients with temporal mandibular joint disorder. It's a joint involving the jaw. Now it's also important to remind the users to keep nicotine, gum or patches out of the reach of children. We don't expect them to be smoking at that age, and there is that risk of overdosing. So let's be cautious. To talk about bupropion, which is stocked under the brand name Zyban at the Aga Khan University Hospital. Zyban is used for smoking cessation. It is one of the first line agents that we at the Aga Khan stock. Now we do a dose titration and start off with a one daily oral dose of 150 milligrams for the first 3 days, after which we increase the dose to 150 milligrams orally twice daily for up to a duration of 3 months. Now we should discourage them from prolonging beyond that duration, unless they are not really serious about cigarette smoking cessation. Now Zyban works by inhibiting the reuptake of norepinephrine and dopamine. It therefore reduces cravings for nicotine and also reduces incidences of withdrawal symptoms that smokers may experience, which can cause them to resort back to smoking, which we are trying to help them stop. Now, when the daily dose exceeds 300 milligrams, you tend to lower the seizure thresholds. These patients then may face the risk of experiencing seizures. Now, we should avoid such doses in patients with underlying seizure history, or those who are using drugs that are notorious for lowering seizure threshold. We know a few like fluoroquinolones, like imipenem, cilastatin, and many others. Now, even clients on monoamine oxidase inhibitors are at a risk because of known drug interactions with Zyban. Now, Zyban tends to stimulate patients to some extent, and it may lead to insomnia. So it's advisable to emphasize that patients take their daily dose or their doses early in the day to avoid this occurring at bedtime. As I said earlier, discourage refilling of prescriptions for use of Zyban beyond the 3-month mark. Now, remember to cautiously use Zyban in patients with hepatic dysfunction and consider administering it even at a dose of 150 milligrams orally every other day to avoid accumulation of the same. Now, my dear colleague, I hope this brief video has empowered you with the tools you require to ensure high success rates as we endeavor to help our clients keen on smoking cessation. Together, you fellow pharmaceutical practitioner and I can make a difference through effective medication use counseling. Thank you very much for your attention.